Welcome. In this video, we are going to walk through a real OET medicine letter, the kind of letter submitted by a real healthcare professional preparing for their exam. By the end, you will know exactly what mistakes cost marks, what the examiner looks for, and how a corrected version reads compared to the original. The title of this video says it all: OET Doctor Referral Letter, what a grade B looks like. Real letter, real corrections, real 320/500 score. Let us get started.
All right, here is the letter. The scenario is GP referral to cardiology, 65-year-old with suspected stable angina. Take a moment to read it. You will see it is a reasonable attempt. The structure is there, the intent is clear. But as we go through it, you will notice exactly where marks are being lost. First, look at this phrase: a 65-year-old retired teacher for a cardiology assessment regarding his ongoing chest pain symptoms. This needs to change to a 65-year-old man for urgent cardiology assessment of suspected stable angina. And here is why. Occupation is clinically irrelevant. The purpose should name the suspected diagnosis and urgency. Second, look at this phrase: complaining of intermittent chest tightness which occurs on exertion. This needs to change to reporting intermittent exertional chest tightness. And here is why. Verb tense inconsistency, presented, occurs, and wordiness. Tighter clinical phrasing serves the reader. Third, look at this phrase: medications include amlodipine 10 mg daily, metformin 1 gram twice daily, and atorvastatin 40 mg. Blood pressure today was 148/92 mm Mercury. ECG showed sinus rhythm with no acute changes, HbA1c 7.8%, and LDL 3.2 millimole per liter. This needs to change to medications, amlodipine 10 mg daily, metformin 1 gram BD, atorvastatin 40 mg NOC/day. Examination and investigations today: BP 148/92 mm Mercury, resting ECG sinus rhythm with no acute changes, HbA1c 7.8%, LDL 3.2 millimole per liter. And here is why. Medications and investigations belong in separate sections. Paragraphing is part of organization and layout. Fourth, look at this phrase: I would be most grateful if you could arrange further cardiac assessment, possibly including a stress test or angiography as you see appropriate. This needs to change to please arrange further cardiac investigation, including stress testing and consideration of coronary angiography. And here is why. Hedging weakens the clinical request. A referral states what is needed, not what would be appreciated. Now, these are not small stylistic preferences. Each of these directly affects how the examiner scores you on the official OET criteria. Let us look at what the examiner actually said.
This is a competent referral that does the job. The reader knows who the patient is, why they are being referred, and what risk factors matter. But it sits at grade B because the purpose is buried inside a long opening sentence, and conciseness and clarity loses marks on irrelevant detail and tense slips.
Now, let us look at the full band descriptor breakdown for this letter. Purpose, band 3 out of 3. Clearly stated, the suspected diagnosis could be named earlier. Content, band 6 out of 7. All clinically relevant information present, one irrelevant detail, occupation. Conciseness and clarity, band 5 out of 7. Some wordiness and hedging, opening sentence too long. Genre and style, band 5 out of 7. Generally appropriate, closing request over-hedged for a clinical handover. Organization and layout, band 5 out of 7. Medications and investigations merged into one paragraph. Separating these gains a mark. Language, band 6 out of 7. Accurate overall, one verb tense inconsistency. Overall, this letter receives a grade B, that is a scaled OET score of 320 out of 500. That meets the minimum grade B required for medicine registration. Well done, but there is still room to push higher.
Get a real OET examiner to mark your letter in 24 hours. At writingcorrectionservice.com, every letter is reviewed by a certified OET examiner, a real human, not an AI, using the same official criteria your exam will be marked against. You receive sentence-by-sentence rewrites, band descriptor scores, and clear guidance on exactly what to fix before your exam. Over 11,000 letters corrected since 2014. Turnaround from 24 hours. Packs start from $18. The link is in the description. Good luck, and we will see you in the next one.